Did you know that certain everyday things can interfere with how amlodipine works and even put your heart at risk? Today, we're going to reveal 5 critical things you need to avoid right now if you're taking amlodipine, so you can get the most benefit and stay safe. This isn't about complicated medical jargon or overwhelming lists, just simple, clear advice that can make a real difference in your health. If you're 55 or older and relying on amlodipine to manage your blood pressure, this video is made just for you. The choices you make daily, from what you eat to the medications you take, can surprisingly impact your heart. Understanding these factors helps you take control of your treatment and avoid unnecessary side effects like dizziness, low blood pressure, or worse. By the end of this video, you'll have a clear action plan to protect your heart and get the most out of your medication. So if you're ready to take control of your health with confidence and avoid hidden dangers, stay with us until the end. This information could save your heart and your life. Number 1. Grapefruit and grapefruit juice. One of the most surprising and important things to avoid when taking amlodipine is grapefruit and grapefruit juice. While it's often seen as a healthy choice, it can cause serious problems for seniors on this medication. Grapefruit contains compounds called furanocoumarins that interfere with enzymes in your digestive system responsible for breaking down amlodipine. This means more of the medication stays in your bloodstream longer than it should, leading to dangerously low blood pressure and increased side effects like dizziness and fainting. The effect is strong. Even one glass of juice can make your amlodipine levels spike, making the drug more powerful than intended. For seniors, that's especially risky because fainting or falling can result in serious injuries. This reaction doesn't just happen with fresh grapefruit. It includes juice, supplements, and dried forms. It's important to know this effect is specific to grapefruit and a few related citrus fruits like Seville oranges. Other citrus fruits like oranges and lemons are safe. Many seniors mistakenly believe all citrus fruits are risky, but that's not true. Take Dorothy, a 72-year-old from Ohio who loved her morning grapefruit juice. After starting amlodipine, she experienced dizziness and low BP. Her doctor explained the grapefruit interaction and advised her to avoid it. Once she stopped, her symptoms improved and her blood pressure stabilized. Your health is a team effort. Knowing how certain foods interact with medication gives you the power to make better choices. By steering clear of grapefruit, you're protecting your heart and allowing amlodipine to do its job effectively.
Number 2. Excessive salt intake. It may sound simple, but watching your salt intake is crucial when you're on amlodipine, especially for seniors managing heart health. Sodium directly affects your blood pressure and can work against your medication. Too much salt causes your body to retain water, which increases blood volume and puts more strain on your heart. That means even if you're taking amlodipine regularly, a high-sodium diet can reduce its effectiveness and make blood pressure harder to control. Seniors are especially vulnerable because aging kidneys don't filter out sodium as well. This leads to more water retention and higher blood pressure, exactly what amlodipine is supposed to prevent. High salt intake is also linked to heart attacks, strokes, and heart failure. James, a 78-year-old retiree from Michigan, faced this issue. Despite taking amlodipine daily, he struggled with high blood pressure. He loved salty snacks and often added extra salt to meals, unaware of its impact. Once he reduced sodium, his BP began to stabilize and he felt more energetic. The problem isn't just the obvious salty foods. Many packaged and processed foods, canned soups, frozen dinners, even bread, contain high sodium. For seniors with kidney issues or diabetes, reducing salt is even more important. Read nutrition labels and choose fresh, whole foods. No matter how well amlodipine works for you, too much salt can undo its benefits. Maintaining a low-sodium diet supports your medication and improves your overall well-being. It's a small but powerful step to help your heart. If you're still watching and finding these insights valuable, comment number 2 below to let me know. And if you haven't subscribed yet, be sure to do that and hit the bell so you don't miss future videos. Number 3. Alcohol consumption. Alcohol is a regular part of social life for many. But if you're taking amlodipine, especially as a senior, it's important to know the risks. Alcohol naturally widens your blood vessels just like amlodipine does. When combined, it can cause unpredictable drops in blood pressure. That might sound good at first, but the result is often dizziness or even fainting. For seniors already at risk of falls, that could be dangerous. John, a 75-year-old retired teacher from Colorado, enjoyed a glass of wine in the evening. After starting amlodipine, he felt weak and dizzy afterward. His doctor explained the interaction. He cut back on alcohol, and his symptoms went away. Alcohol can also disrupt your heart rhythm and interfere with how your liver breaks down medication. That affects how amlodipine works and can lead to side effects like palpitations, chest discomfort, or shortness of breath. Plus, alcohol can lead to poor eating habits, dehydration, and bad sleep, all things that make blood pressure harder to control. You don't necessarily have to stop drinking completely, but moderation is key. Talk to your doctor about what's safe for you. Reducing or avoiding alcohol is a simple way to stay safer while on amlodipine.
Number 4. Over-the-counter cold and allergy medications. Many seniors reach for these remedies without realizing they can interfere with heart health. Some contain ingredients like decongestants, pseudoephedrine, and phenylephrine that raise blood pressure and fight against what amlodipine is trying to do. These decongestants narrow blood vessels to reduce swelling, but this increases BP, which is dangerous when you're taking a medication meant to lower it. Linda, a 68-year-old grandmother from Florida, took a cold medicine during flu season and noticed her blood pressure spike. Her doctor explained the interaction, and after switching to safer options, her BP improved. Antihistamines on their own don't usually raise BP, but combination products with decongestants require caution. Even small increases in BP can raise the risk of heart attack or stroke in seniors. Read ingredients carefully and check with your doctor or pharmacist before taking anything new. Natural alternatives like saline sprays, steam, or allergy-proofing your home can help without the risk. Don't underestimate how OTC meds can interfere with your treatment. Amlodipine helps protect your heart, and that protection extends to everything you put in your body. If you're still here, comment number 4 so we know you're with us.
Missing doses or abruptly stopping amlodipine. Consistency is key when managing blood pressure. Skipping or stopping your meds without talking to your doctor can cause dangerous spikes in blood pressure, putting you at risk for heart attacks or strokes. Amlodipine works over time by relaxing your blood vessels and easing strain on your heart. If you miss doses, the medication level in your system drops and its effects wear off quickly. Blood pressure rises and your heart works harder. Stopping suddenly is even worse. It can cause rebound hypertension, where BP jumps even higher than before. George, an 80-year-old retired postal worker from Pennsylvania, felt fine and skipped his meds for a few days. He ended up in the ER with a severe headache and dizziness. His doctor warned him never to stop without medical guidance. George started using a pill organizer and reminders, and his BP stabilized. Forgetting meds is common with age, but tools like alarms, apps, and help from family can keep you on track. If you're having side effects, talk to your doctor. Don't stop on your own. Regular checkups and BP monitoring help your provider adjust your dose and catch issues early. Following your prescribed routine keeps amlodipine working as it should. Final thoughts. Let's take a moment to reflect on the 5 critical things to avoid if you're taking amlodipine: grapefruit, excessive salt, alcohol, risky OTC meds, and missed doses. These tips aren't just rules, they're ways to get the full benefit from your treatment and protect your heart. Managing heart health is a lifelong journey. Small changes like cutting salt, skipping grapefruit, or taking your meds on time show your commitment to that journey. Share in the comments one thing you learned today and how you'll apply it. If this video helped you, please like, subscribe, and share. Your support helps us keep creating helpful, inspiring content. Thanks for watching, and we'll see you in the next video.